Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth Ratio CoQ10 and Statins, the shocking truth about muscle relief. And trust me, it's juicier than your cousin's peach cobbler. Are your statin medications causing muscle pain and fatigue that's making you want to quit your heart medication? Oh boy, if I had $1 for every time a patient told me they'd rather risk a heart attack than deal with those achy, tired muscles, I could buy my own hospital. Today we're going to reveal a simple supplement that could solve this problem and keep your heart protected. Because quitting your statins is like canceling your health insurance right before you need surgery. Let me tell you what's really happening inside your body when you take statins. These medications are fantastic at blocking cholesterol production. They're like bouncers at an exclusive club, keeping the bad cholesterol from getting through. But here's the kicker nobody tells you about. They also block the production of something called CoQ10. Now, CoQ10 is like the Energizer Bunny for your muscles. It's the little molecule that keeps your muscle cells powered up and happy. When statins deplete your CoQ10, it's like unplugging the coffee maker at a Monday morning staff meeting. Everything just stops working properly. Your muscles start aching, you feel weak, and you're dragging around like you've been hit by a truck. Up to 30% of statin users experience this, and yep, entirely true, I can't make this stuff up. Your heart muscle, which works harder than a single mom with 3 jobs, needs CoQ10 most of all. So this deficiency is doubly dangerous. It's like taking away the fuel from the engine you're trying to protect. Now, here's where it gets interesting. CoQ10 supplements can restore what statins take away without messing with your cholesterol-lowering benefits. It's like having your cake and eating it too, except this cake actually makes you healthier. Research shows that taking 100 to 200 milligrams daily of the ubiquinol form works best because it absorbs like a sponge in water. The regular CoQ10 absorbs about as well as trying to drink through a straw with holes in it. Here's what cracks me up. Some doctors act like CoQ10 and statins are mortal enemies, like they're going to duke it out in your bloodstream. That's absolutely ridiculous. They work together like peanut butter and jelly. The CoQ10 doesn't cancel out your medication's heart protection. It actually helps your heart muscle stay strong while the statin does its cholesterol-busting magic. Let me tell you about Maria, a 58-year-old patient who came to see me looking more defeated than a sports fan whose team just lost the championship. She couldn't climb stairs without her legs screaming at her after starting statins. Her previous cardiologist actually suggested she stop taking this life-saving medication. I nearly fell off my chair when she told me that. If you're experiencing severe muscle pain on statins and your doctor's first suggestion is to quit them entirely, maybe I should see you in the clinic. We need to talk. Anyway, back to Maria. I started her on 150 milligrams of CoQ10 daily, and after 6 weeks her muscle pain disappeared like a magician's rabbit. She stayed on her statins, and 2 years later her cholesterol remains beautifully controlled and she's completely pain-free. She actually sent me a video of her running up those same stairs that used to torture her, made my whole week. The key is getting the right form and taking it correctly. You want ubiquinol, not ubiquinone. Think of ubiquinol as the premium gasoline for your cellular engine. And here's a pro tip that'll save you money and frustration. Take it with a meal that contains some healthy fats. CoQ10 is fat-soluble, which means it needs fat to get absorbed properly. Taking it on an empty stomach is like trying to wash your car with no water. It just doesn't work. So here's your actionable takeaway, and listen up because this could change your life. Before you even think about quitting your statins because of muscle pain, talk to your doctor about adding CoQ10. Start with 100 milligrams of ubiquinol daily with a meal containing healthy fats for best absorption. Give it at least 6 to 8 weeks to work its magic. Remember, your muscles didn't get depleted overnight, and they won't bounce back immediately either. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.